Hi, this is Dr. Larsen at SLC Med Spa. Today we wanted to talk about the new procedure called InstaLift. The InstaLift is a new procedure where we actually use sutures to be able to lift tissue on your face. As we age, the muscles on our face get tighter and we create wrinkles through muscle movement in the forehead, between the eyes, the sides of the eyes. We've been able to treat this in the past with Botox and Dysport, and many people have had Botox and Dysport and have actually loved the results. Also, as we age, we lose volume in our face. We lose volume from bones. Our bones get smaller as we get older. We lose muscle mass in our face. We also lose fat in our face, which causes sagging and loss of volume. In the past, we've been able to use filler to replace volume. We have multiple options now with fillers, long-lasting fillers and different fillers to be able to replace the volume and make you have a more youthful look. For the sagging areas of our face, which is a really big complaint from a lot of my clients, there hasn't been a lot of options in the past. We've been able to use radio frequency or oral therapy to do some tightening to get some mild improvements. The only other option in the past has actually been surgery, or using permanent sutures to lift the tissue. The permanent sutures there's been multiple complications with permanent sutures, so they're not very popular. Patients haven't liked this option. So the options to lift tissue in the past has been very minimal, other than surgery. There's been a new procedure called InstaLift that has been out for about a year and a half now, and it is just getting incredible reviews, and patients have been loving this new procedure called InstaLift. With InstaLift, we're able to lift the tissue, which we haven't been able to do in the past, in a very, very safe way. We're actually using a suture that is absorbable. It's not permanent, and with these absorbable sutures, they are very, very safe. The complication rate is actually less with these sutures than it is with fillers. The complication rates on the initial thousands of sutures that have been placed is less than 1%. What the suture is it's a suture made out of the same material as a vicryl suture, which if you've ever been to the emergency room or in the hospital and your doctor does stitches on you and puts deep stitches, usually it's made out of vicryl material. So the suture is made out of vicryl, but most of the suture is made out of the same material that is in Sculptra, the filler Sculptra. So if you've had Sculptra, that's what most of this suture is made out of. The suture has cones on it that allows the suture to pass through the tissue in one direction and does not go back through the other direction. So here, just to illustrate this, I've just made a cone out of some paper, and what the suture does is the suture will go through the cone and come out the other direction, and there's about 4 cones on the suture. They're just little teeny cones about that big. They're very, very small that are on the suture. There's 4 on one side and 4 on the other side of the suture. And the suture, as it goes under the skin, we pull the suture under the skin. The cone allows the suture to go this direction. But then if you pull the suture this direction, the cone, this part of the cone actually gets caught on the tissue under your skin and will not move this way. So these sutures that are made out of a very, very safe material are allowed to pass one direction, but they can't go through the other direction. When we place the suture, all we do is when we're placing the suture, we're going to treat areas where we have sagging skin. The most common area where someone complains of sagging skin is in the jowls or in the marionette lines here. But we can pull back tissue from the smile lines here. We can pull it back from the marionette lines here. We can pull it back from sagging jowls, and we can also pull the skin back on your neck to tighten the skin under your neck. So with these sutures, these are all the different areas that we can treat. And all we do is we just take this our little marking ruler, we look where we want to pull the skin. On Chris here, we'd probably want to pull this back and maybe pull this back. So we just do our little mark here on the skin. We put a dot with the marker. We're going to mark you here, Chris. This is just a dry eraser, so you'll be able to just pull that off. But we would mark where we want the suture to come out. We would mark where we want the suture to go in, and we would mark where we want the suture to come out here. So if we could pull that tissue like that, it would just it would just take care of this loose skin. Also on the jowls, we could put a suture this direction. We could mark here, here, and here, and we could put a suture and it would pull up just like that and just give her an amazing look. This suture, all we do is minimal pain, very non-invasive. The procedure takes about 30 minutes, and all we do is we take a little teeny tiny 30 gauge needle and a little bit of lidocaine that has a little bit of bicarbonate in it so it doesn't hurt, and we would just inject these spots with a little bit of lidocaine, and then the spot here in the middle is where we put the suture in. The suture has a wire on one end of it, and we put it through the skin where we've numbed it, and we've poked a hole in the skin, and then we push the wire until it comes out at this spot right here. The wire goes between the muscle and the skin where there's very little nerves. Most people, as we push that wire through that area, they don't feel it at all. If any of you out there have ever had a filler placed by a cannula, you know that as we push that cannula between the skin and the muscle, there's very little to no pain. This is just like the cannula. We put the wire in, we push it between the skin and the muscle where there's almost no nerves. Most patients actually don't feel this as we put it through here. And then this area where the wire comes out, it's actually numb. We already numbed it with lidocaine. So as that comes out, you don't feel it either. We pull the wire out, and on the end of the wire is the thread, the suture. And as that is pulled out, these little cones are pulled under the skin, and it will slide this direction under the skin. Then we take the other end of the suture, which has a wire. We put it back in this exact same hole that's already been numbed, and we've already poked it open with a needle, and we push the wire this way, and then it comes out here where we've numbed. And again, very little to no pain. The wire comes out, we pull the wire out, and the thread, the suture thread, gets pulled under the skin, and these little teeny tiny cones get pulled under the skin this direction, and it moves this way, but it won't move that way because this cone is going to get caught under the tissue as it tries to pull this way. So we have a thread down here that can go this way, but it can't go this way. And we have a thread up here that can go this way, but it can't go this way. So we put it in here, we put it in here, we take the suture, we do a little tug on it, that simple. This pulls up like that, and then it's anchored because it's got these cones in it. It can't move backward. It can take pounds of pressure on this and it will not move. And then we just take some scissors, we snip off the ends of the suture, we snip off the ends of the suture. There's no knots that are tied. We just pull the skin up a little bit. The suture goes underneath the skin and it's there, and it lasts about 9 months to a year before the suture is going to dissolve. Since the suture is made out of the same stuff that Sculptra is, Sculptra makes you produce collagen. So along this track where the suture is, we're going to get a bunch of collagen made, and we're going to get some long-lasting results, a year at least, maybe even up to 2 years of this lifting and pulling. So a really, really neat new procedure. It takes about 30 minutes. Minimal pain, it hurts less than doing fillers, and little to no downtime. In fact, I actually had this done to myself last night here in the clinic a little over 12 hours ago. You can see on my face, there's the You can see on my face there's the little pokes here. That's where the wire went in. Then the wire came out right here, and I have one poke here and one poke here, so I have 2 threads that were placed to treat my marionette lines. I've had a great results. We'll put my before and after photos online so you can see that. But about a 30-minute procedure, a poke here, the wire came out here, it did not hurt. Less painful last night when I had this done than doing filler. And as you can see, here I am today, a little over 12 hours ago I had this done. There's no downtime. You have it done and you can go back to work the next day. I love how this is flattened out a lot of my marionette lines. I love what it's done to me for lifting with just 2 threads. Most people are going to require anywhere from 2 to 5 threads on each side. For me, I just worked on this one spot. I could have put maybe one down here on my jowl, but all we did last night is just 2. Again, it's a poke here, thread came out here, the other side of the needle went in here, and it came out right up here. No bruising at all. I thought it hurt less than filler. So really, really cool, neat procedure. This is a breakthrough procedure. I think this is going to be as big as filler, as big as Botox. We've been able to treat the wrinkles in the forehead and around the eyes, wrinkles caused by muscle movement with Botox and Dysport, which has worked amazing. We've been able to treat the loss of volume in your cheeks and wrinkles around your smile lines with filler in cheeks, temples, smile lines, chin. But this sagging here, the loose skin on the neck, there really has never been a really good option except for surgery until now. This InstaLift is incredible, minimal pain. I think it's working great on our patients that we've done it on. You look on Real Self and on the internet, the approval rating is amazing. The complication rate is less than with Botox or with filler, and we're getting great results. So anyways, that's the InstaLift, a great new procedure to lift up those jowls, tighten the neck, lift up the marionette lines, pull back the cheek where you have your smile lines, and getting some amazing results. So anyways, thanks for joining us at SLC Med Spa. Again, this is Dr. Larsen. I hope this video has been some good information. Thanks a lot.